What is the importance of resident doctors?
Well, they are the doctors undergoing training to become specialists in different fields of medicine. And during this training process, they also offer services to members of the public. So by the number is about 16,000 nationwide, and when you consider that that's a large percentage of the total number of doctors practicing in the country now, you agree that they actually form a major bulk of the medical team in the country.
Would like to know from you what exactly are the reasons that they are embarking on this strike?
Okay. Quite a number of reasons. Yes, for quite a while now, doctors have been getting percentages of their salaries, which is to say that they've not been getting full salary for some months, in some centers more than a year. So so that has also led to the accrual of several arrears of these shortfalls in salaries. So there's also this issue of non-enrollment of doctors in this platform called Integrated Personnel Payment Information System. It's just a platform used for paying the salaries of doctors, which take care of some of the challenges associated with the present platform. So part of the demand is that the migration to that platform should be speeded up so that all the challenges associated with the present platform can be addressed. The issue of pension is also a turning point, which form a major and important part of the demands of NARD. The Pension Act is very clear. It says resident doctors are pensionable, but for up to 2 years now, the counterpart funding from the federal government has been removed. So this has not been the case for other cadres of workers. So we are saying that this should be addressed to what is source for goods for the goods is also source for the gander. So we are saying that this should be that funding should be restored. Then there was this agreement that was also reached with officials of the federal government several years ago pertaining to the entry level for house officers. A lot of centers have still not started the implementation of this agreement on the entry level for house officers. So these are the issues, and they are not new issues. We've been having several discussions with officials of the government on how to resolve these issues, but up till now. So that was what informed the present strike action.
Considering the oath taken by resident doctors to protect lives at all times, should strike actions be an option?
Well, in places where checks and balances have been put in place to also ensure that issues do not generate to the point of total breakdown of understanding, then you could say that yes, maybe strike action would not be justified in that setting. But in a setting where all those checks and balances have not been put in place, then it would be unfair to say doctors should not use that means to push their demands across.
In your previous statement, you did mention that there are over 16,000 resident doctors in Nigeria. So when these doctors go on strike, who manages the medical services delivery?
Yeah, there are other cadres of doctors who do not belong to the Association of Resident Doctors. Consultants also work in the different hospitals. If you have also been following the arrangement put in place by the federal government, they've mobilized core doctors and doctors serving under the NYC. Then, so these are and they've also tried to employ other cadres of doctors. So by and large, these are the cadres of doctors who have been attending to patients in the absence of resident doctors.
In your perspective, do you think this crop of doctors would be sufficient to handle?
If that was the ideal arrangement, then there wouldn't have been a need for resident doctors in the first place. So it's not ideal, but we also understand that there's a need for them to fill in the gaps while negotiations continue to address the issues.
The federal government and resident doctors had come to an agreement with the collective bargaining agreement, and yet doctors had refused to keep to their part of that bargain and continued with the strike. in your opinion, what had led to the doctors backing out of the agreement?
Well, first of all, it was clearly stated at the point where the agreement was being signed that the agreement would need to be ratified by the National Executive Council of NARD. So as such, and that point was clearly made. So that's on one hand. To answer your second question, so what may have informed the rejection of that document? Yes, and I say it's because these issues have become perennial, and we've signed several agreements before in the past. So maybe the doctors didn't just see a clear demonstration that there's a departure from the past where agreements were not implemented. So I guess we're actually holding out to see a very clear demonstration that this time around this agreement will be implemented.
Since this is a nationwide strike, before commenting, were there plans put in place to assist victims of the cholera outbreak in Borno and probably victims of the Benue State flood that has been, ongoing for a while now? Were there plans put in place for that?
As I said earlier on, there are other cadres of doctors who form part of the health team in the different hospitals. If you also consider the fact that a 21-day ultimatum was actually issued before this strike was embarked upon by NARD, then you would expect that the different hospital management would have put in place measures to adequately address these issues you mentioned, victims of the Benue flood and also victims of the cholera outbreak in Borno.
I'd like to know from you what the federal government is offering, and is there a meeting point between what the federal government is offering and what National Association of Resident Doctors are demanding? Is there some kind of compromise in between?
Well, I'm unable to reveal the details of what they are offering, and because it is a document that is still going to be deliberated by the National Executive Council, so it would be preemptive for me to start discussing the details now. All I can say is that NEC members are reasonable, and as soon as if those offers are also reasonable, then I'm sure there will be a speedy resolution to the issue of strike.
How do we ensure that we don't continue to have strike actions by doctors in the future?
I've also mentioned in different fora before that for doctors to even carry placards and say and declare a strike action is a sad commentary on the part of the public. I say this because I feel the public too should also take ownership of the health sector. It's a critical sector. As such, the agitation should not be left to the doctors alone to carry on. So I think as a way of going forward, members of the public should also become better involved in what is happening in the health sector. That way, maybe we won't have to get to the point of declaring a strike action before issues are resolved.
When you say that members of the public should be better involved, how do you mean?
Yeah, there are civil society organizations, there are non-governmental organizations who can actually bring their influence to bear on the policymakers to ensure that demands are met. And so those are, and they can also provide a better platform for negotiation between the parties in the health sector.